This is vaccines in 10 minutes. So what are the different types of vaccines? Well, there are killed or inactivated vaccines that do not have active forms of the virus or bacteria that we're using that can promote IgM and IgG responses. This includes rabies, influenza injections, inactivated polio vaccine, which is the injectable form, and hepatitis A. There are also toxoid vaccines, which use a product of the bacteria typically that is able to engender an IgM or IgG response. The most common one we think of is tetanus and diphtheria. Conjugated vaccines are vaccines that take a piece of the bacteria in mind and then conjugate it to a carbohydrate or protein so that we can get a better response. This can promote IgM or IgG responses. And the vaccines we typically think of are H. influenza, pneumococcal or PCV vaccine, or meningococcal vaccine. Now, similar to this is the subunit vaccines, which take just a small piece of the bacteria and elicits a response from our immune system. And this would include hepatitis B and HPV vaccines. We also have RNA vaccines recently due to work done at Penn, and this only includes currently COVID vaccines. Finally, there are many live attenuated vaccines, which take a weakened version of the virus that can promote long-term immunity from these agents. This includes measles, mumps, and rubella, or MMR vaccines, varicella, and shingles. So how do I know what vaccine to give to a child? Well, the CDC puts out a vaccine schedule that tells us which vaccine should be given when for a child. This is very complicated and can change over time, so it's always worth going to the website or using an app to help identify what vaccines are actually used. Here, I'll try to present some of the key principles, but you should not memorize all of the details for every vaccine. So zooming in on the first year or so of life, most vaccines are actually given at 2 months, 4 months, and 6 months. And these are often combined into fewer shots to make it easier. So you can often combine 5 components or more into one vial so that the infants are not having as unpleasant of an experience. Now, in that first year of life, you're also likely to get your first influenza and COVID shots. These are shots that they should get every single year. But it's important to note that the first time a kid gets a flu shot, they actually need to get a second dose at least 4 weeks later in order to have full efficacy. Finally, starting at age 1, you can start to receive live attenuated vaccines. These would include the MMR and varicella vaccines. For these vaccines, they promote long-term immunity, so you only give one more dose again at age 4, and then they're typically good for life. Now, the only time we sort of think about those later on is that we may check the antibody levels or titers during pregnancy to assess the risk of vertical transmission of rubella and varicella. If someone is pregnant, they should not receive these vaccines, but if they're unimmunized or non-immunized, they should receive that after they've delivered the baby so that they can be immunized for future pregnancies. Now, the other ones that we think about are vaccines that are given a little bit later in life. So kids also get a further tetanus shot starting at age 7, and then it becomes an every 10-year process for the rest of their life. The HPV or human papillomavirus vaccine is typically started at age 11 or 12. And if you do that at that time, they only need 2 doses. But if it starts after the age of 15, you need to do 3 in order to get the maximum efficacy. The reason you would want to start it is that you want it to start before sexual activity occurs, and this can help prevent cervical cancer, especially for women, but also can prevent cancers in men. Finally, the meningococcal vaccines happen around teenage years and college as they're more associated with close proximity. So what happens if I fall behind on giving vaccines to a child? Well, in addition to the normal CDC vaccine schedule, the CDC also publishes a catch-up vaccine schedule, and this outlines the minimal intervals you must have between doses in order to still have full efficacy. And so for each vaccine that they're behind, you can see between dose 1 and dose 2, dose 2 and dose 3, and so on, how much time you need between in order to complete the series. So what vaccines do adults get? Sure enough, the CDC also publishes an adult vaccine schedule, but I think there are broader principles that you should think about rather than memorizing the details. So first, every adult should be getting COVID and flu vaccines every season. This is typically updated each fall. During pregnancy, there are a couple vaccines that we think about. Now, every person who is pregnant in the third trimester, they are getting the RSV vaccine. At 28 weeks, they're also getting the Tdap vaccine because that can help prevent pertussis in their infant after they're born. Finally, as I mentioned before, during pregnancy, you'll often test antibody levels for varicella and rubella in order to see if they're immune so that they do not vertically transmit these infections to the fetus. High-risk patients who have multiple comorbidities or immunocompromising conditions will get the pneumococcal conjugated vaccine or PCV vaccine. The most common indications I see for this are respiratory conditions, diabetes, and HIV. Finally, older adults all get the pneumonia vaccine. They should also get the shingles vaccine, both of which now are recommended to start at age 50. And adults also get an RSV vaccine, either at 60 or 75, depending on their risk level. So why don't people want to vaccinate their children, or why don't they want to get vaccinated themselves? Well, the most common reasons include religious reasons. However, this is not true of the vast majority of world religions. There are very few religions that considered this a possibility when they had written down their beliefs. And so this is actually not consistent with most practices that we see across the world. People are also concerned that they're not very effective. They're also worried about dangerous side effects. And finally, they're worried about excess chemicals that are not natural going into the body. So let's talk about the ineffectiveness, dangerous side effects, and excess chemicals in order to help us gain the skills to be able to respond to vaccine hesitancy in the clinic. So, how effective are vaccines? Well, for child vaccines, they are incredibly effective. All the vaccines that we give have more than 85% efficacy in preventing the actual infection of the virus or bacteria, and also can prevent hospitalization with severe causes. In particular, the polio vaccines are more than 99% effective and really help to eradicate most of the cases of polio. Adult vaccines are not quite as effective. The original COVID primary series of the first 2 doses was shown to be 95% effective at preventing COVID, but subsequent boosters are more useful for actually preventing hospitalization with severe illness rather than preventing the acquisition of the virus. Notably, seasonal flu and pneumonia vaccines are only about 40 to 50% effective. These are really great for preventing serious infections, but might not prevent you from getting the infection by itself. However, if they can keep you out of the hospital, they're still very useful to offer to patients. So, what are the side effects that people are concerned about? Well, first and foremost, vaccines do not increase the risk of autism. This idea was based off of fraudulent studies done in the 1990s by a British researcher named Andrew Wakefield and have been consistently debunked by subsequent research. However, there are known side effects, and most people are not actually affected by vaccines. But the side effects can include swelling, pain, and erythema at the sites of injection, fever or headache that can last usually less than 2 or 3 days and is responsive to Tylenol and ibuprofen. And then rarely, Guillain-Barré syndrome can be associated with the flu vaccine, which would lead to a severely compromising neurological disorder. But this is on the order of 1 in a million. Live vaccines can also give minor symptoms of the virus because they're weaker versions. And so it's especially important not to give them to patients who are already immunocompromised, either with HIV or who are pregnant. Now, to address the chemical concerns about vaccines, one of the chemicals people are concerned about is aluminum. But this has actually been used very safely for more than 90 years. And only recently have we started to see any evidence that maybe they have small effects. One recent study that the CDC mentions is that there is a small risk of increased asthma in patients who already have atopic risk factors. So if they have eczema or a family history, they might be more likely to develop asthma with aluminum containing vaccines. But this is only one study and should be taken with a grain of salt. Now, one of the more common things that people are concerned about is thimerosal, a mercury-based agent that we used to use to reduce contamination of vaccines. However, this hasn't been used in more than 20 years, and there have also been very many studies that show there was no association with autism. As a result, while patients may bring this up, this is not really founded in anything that we'd expect for treating people today. So the CDC puts out a recommendation for how to approach vaccine hesitancy in the clinic. First, you should always assume that people will agree to vaccinate. And so if you offer them the vaccine and they consent with no further questions, you should just move on with the rest of the visit. If someone is not ready to vaccinate, you should give them a strong recommendation about why you think it would be important. And if they accept that recommendation, go ahead and give it. If they have specific questions or concerns, you should empathically listen and try to understand their position. There's a history of people giving vaccines and not knowing what they're getting, and as a result, taking advantage of different marginalized groups. And so always be aware that they may have some historically appropriate belief in why they don't want to get vaccines, and you want to continue to build the conversation so they keep coming back to see you. So in terms of takeaways, the CDC vaccination schedule has all the info for which vaccine to give and when. Do not give live attenuated vaccines during pregnancy and in the first year of life. The majority of childhood vaccines are more than 90% effective at preventing illness. Keep giving vaccines all the way through adulthood. And when side effects occur from vaccines, they typically last less than 2 or 3 days and can be managed with supportive medications.